Podcast 3 of the Abdomen series, the Oesophagus and Stomach. This podcast is going to detail the anatomy of both the esophagus and the stomach and will include their function, blood supply and autonomic innervations. So let's start with the esophagus. The esophagus is a muscular tube that is approximately 25 centimeters long and begins at the level of the 6th cervical vertebra as a continuation of the pharynx, and joins the cardia of the stomach at the level of the 11th thoracic vertebra. It is responsible for transmitting food from the mouth to the stomach for digestion. As the esophagus passes inferiorly through the neck and mediastinum, it follows the contours of the vertebral column and is directly posterior to the left atrium of the heart. As it passes through the diaphragm via the esophageal hiatus to enter the abdomen, it assumes a covering of peritoneum with a layer of peritoneum from the greater sac covering its anterior surface and a layer of peritoneum from the lesser sac covering its posterior surface. Once it has passed through the esophageal hiatus at the level of the 10th thoracic vertebra, it joins the stomach at the cardiac orifice and forms the esophago-gastric junction, which is slightly left to the midline and, as I mentioned, is at the level of the 11th thoracic vertebra. At the esophago-gastric junction, there is a jagged shaped Z-line which marks the transition from the esophageal to gastric mucosa. Slightly superior to this junction is the musculature of the diaphragm, and this forms the inferior esophageal sphincter. This sphincter is known as a physiological sphincter, and it's involved in regulating the entry of food into the stomach. It differs from an anatomical sphincter, like the pyloric sphincter, because it does not contain a specific thickening of circular muscle, and I'll detail the pyloric sphincter later in this podcast. If we consider the structure of the esophagus, then the inner mucosal layer consists of non-keratinizing stratified squamous epithelial cells, whilst the outer muscular layer consists of either striated or smooth muscle, which conveniently divide the esophagus into 3 parts: the superior, middle, and inferior parts. The superior part of the esophagus is composed of striated muscle, which is continuous with the constrictor muscles that forms the walls of the pharynx. The superior part, which contains the voluntary striated muscle, is also regarded as the upper esophageal sphincter, which is involved in allowing a bolus of food to pass from the pharynx into the esophagus when we swallow. The inferior third of the esophagus is composed of smooth muscle and is therefore under autonomic control, with the middle third of the esophagus being composed of a mixture of striated and smooth muscle and is really a transitional area between these 2 muscle types. So to finish this part of the podcast that's dealing with the esophagus, I want to detail the blood supply and innervations. The thoracic part of the esophagus is supplied by the esophageal arteries, which are a direct branch of the aorta. The smaller abdominal part of the esophagus is supplied by the left gastric artery, which is a branch of the celiac trunk, and also by the left inferior phrenic artery. For the venous drainage of the abdominal esophagus is via the left gastric vein, and this drains into the portal system. Under certain conditions, like portal hypertension, the abdominal esophagus can drain into the systemic system via the esophageal veins, and I will detail this route in a later podcast in this abdomen series. For the autonomic control of the esophagus, then it is surrounded by the esophageal nerve plexus, and this is formed from both parasympathetic and sympathetic fibres. This plexus is important in regulating the amount of mucus secreted from the mucus glands in its submucosa, and also controls the level of peristalsis. So for the second part of the podcast, let's move on to the stomach. Now the stomach is the most dilated part of the gastrointestinal tract and joins the esophagus to the duodenum. In the majority of people, the stomach is J-shaped and located to the left of the midline in the epigastric region of the abdomen. But with changes in body position and the consumption of food, it can assume a variety of positions throughout the abdominal cavity. Its main responsibility is for enzymatic digestion, and it does this both mechanically by contracting the muscles of the stomach to churn the food, and also chemically by secreting gastric juices, which are an acidic mix of enzymes. So let's detail the structure of the stomach, which can be divided into 4 parts. There is the cardia, the fundus, the body, and the pylorus. The cardia of the stomach surrounds the cardiac orifice as it forms the esophago-gastric junction. To the left of the cardia is a dilated superior portion, which is the fundus. This region is related to the left dome of the diaphragm, and it can reach the level of the 5th intercostal space. The fundus of the stomach is separated from the body by a horizontal plane that is in line with the cardiac orifice. Now the body is the largest part of the stomach, and it's continuous with the pyloric antrum inferiorly. As the body turns rightwards, it narrows into a funnel, which is the pyloric antrum, and this then narrows to form the pyloric canal, which is continuous with the first part of the duodenum. The pyloric canal is the most distal portion of the stomach and is surrounded by the pyloric sphincter, and this has a thickening of circular smooth muscle which controls the outflow of chyme from the stomach into the duodenum. Because of the substantial thickening of circular muscle that forms the pyloric sphincter, this sphincter is regarded as an anatomical sphincter. Internally, the stomach is a reddish-brown colour, which when contracted forms a series of elevations or gastric rugae. These rugae allow the stomach to expand in size during digestion, and when the stomach is distended, these rugae are completely flattened. The epithelial lining of the stomach contains simple columnar cells, which secrete a protective covering of mucus and form deep gastric pits. At the bottom of the gastric pits are a series of gastric glands, which extend into the lamina propria, and are lined with parietal cells that secrete hydrochloric acid, and chief cells that secrete pepsinogen. The external musculature of the stomach is slightly different to other parts of the gastrointestinal tract, as it contains a third muscle layer. Positioned deep to the circular and longitudinal layers of smooth muscle is an oblique layer, and this helps with the complex churning movements responsible for mixing the mass of food into the semi-liquid chyme. The external surface of the stomach is covered by the peritoneum that extends from the lesser and greater omentum, and is characterized by 2 curvatures and 2 notches. There is the lesser and greater curvatures, and the cardiac and angular notches. The lesser curvature is on the right side and is continuous with the right border of the esophagus superiorly, and forms the angular notch where it meets the pyloric canal inferiorly. Running between the liver and the lesser curvature is the gastrohepatic ligament, which is part of the lesser omentum. On the left side of the stomach is the convex greater curvature, and draping from this curvature is the descending layer of greater omentum. Positioned superiorly, the cardiac notch is located between the fundus and the left border of the esophagus. So to finish the podcast, I want to detail the blood supply and autonomic innervations of the stomach. The stomach receives a plentiful supply of arterial blood from the celiac trunk and its branches. The majority of the blood is supplied by 2 pairs of arteries, the right and left gastric arteries, and the right and left gastromental arteries, which are sometimes referred to as the gastroepiploic arteries. Both of these pairs of arteries form anastomoses along either the greater or lesser curvatures. The 2 gastric arteries run along the lesser curvature and join, and the 2 gastromental arteries run along the greater curvature and join. An easy way to remember which arteries run along which curvature is to remember that the gastromental artery is a long word and therefore runs along the greater curvature. The gastric arteries is a shorter word, and this will run along the shorter, lesser curvature. The fundus and body of the stomach are supplied by the short gastric arteries, and these come directly off the splenic artery, which is running posterior to the stomach. I will detail the exact distribution to the foregut via the celiac trunk in podcast 8 of this series. The venous drainage of the stomach follows the same course as the arteries, with the gastric and gastromental veins draining into the portal system of veins. But like I said previously, I'll go over this in more detail in podcast 8. So finally, the autonomic innervation of the stomach, parasympathetically, is via the vagus nerves, which enter the abdomen either side of the esophagus as the left and right vagi. Due to the rotation of the stomach, the left vagus nerve becomes the anterior vagal trunk, and the right vagus nerve becomes the posterior vagal trunk. Both of these nerves run over the surface of the stomach and contribute to the celiac plexus. Sympathetic fibres originating from the T6 to T9 segments of the sympathetic trunk form the celiac plexus via the greater splanchnic nerves, and these fibres leave the celiac plexus to innervate the stomach by following the gastric and gastromental arteries. The sympathetic fibres are going to be involved in reducing the contraction and also reduce the level of acidic enzymatic secretions. The parasympathetic influence on the stomach will increase its muscular contractions and will also increase the amount of gastric juice that's released. So in this podcast, I've detailed both the esophagus and the stomach, detailing their main internal and external features, and also giving a brief overview of the vessels and nerves associated with these organs. I will just remind you that in podcast 8 of this series, I'll give a more detailed account of the arteries and portal system of the abdomen, and in podcast 11, I'll give a more detailed account about the somatic and autonomic nerves of the abdomen. So in the next podcast, number 4, I'll describe the duodenum, the jejunum, and the ileum.